Hi, Dr. Choll Kim here from San Diego and North American Spine Society. And I have Dr. Thomas here from the Cleveland Clinic, and we're going to talk about spinal epidural steroid injections. Dr. Thomas is at the Cleveland Clinic, a premier spine institute, and he is a physical medicine and rehabilitation doctor. Turns out the field of spine surgery has essentially two types of spine specialists. One type, or one group, like me, are the surgeons. We are trying to perfect surgical techniques and trying to figure out who are best treated with surgery and what types of surgeries. But the majority of patients that I take care of, and the majority of all spine patients, do not need surgery, so they just need lots of non-operative treatment. And so most of the care is done by the other group of spine specialists, like physical medicine and rehabilitation, neurology, anesthesiology. Some of them are also even further specialized in pain as a pain specialist. So Dr. Thomas will talk about injections. So Dr. Thomas, from a patient's perspective, when should a patient consider doing a spinal epidural and submitting to having a big needle stuck in their back or their neck?
They should consider spinal injections if they've failed conservative care options, if you've failed time, medication, and even physical therapy. If those things are not helping you and you still have persistent pain, then you should consider spinal injections. This is shorter than surgical options. If you're thinking about surgical options, sometimes this can help you sort things out. A lot of times our surgeons will send patients to us to make sure they have the roots or the nerves isolated. It makes their surgical yield better. So when you look at the spectrum of options, this is somewhere where you want to do something but not as aggressively as surgical options are available, because most of the back pain, as you mentioned, is non-surgical. Nearly 90% is treated non-surgically, and of which majority of it is still treated non-invasively. Injections are invasive. You're taking a needle and going into the spinal structure and putting some medicine at the target site. When you take medications by mouth, it may take a little longer to get to the target site. So if it's not making a difference for you and you cannot continue with your activities, then you would want to consider spinal injection.
So in general, for most patients, spinal injections comes after things like physical therapy, some medications, activity modification, a little bit of time to see if things get better on their own. And the patients that don't, they get injections. So it's kind of most of the time. You brought up something that's really important too. While we're trying to get patients better non-operatively, including doing injections, I also really rely on the injections to fine-tune my diagnosis. So here's the weird thing about spine. Imagine you have a knee with 5 knee joints in one leg, and you show up with right knee pain. You have to try to figure out which knee joint is causing your right knee pain. There's 5 essentially discs in the lumbar spine, and so that's the problem that we have. Sometimes it's 1 level, sometimes it's 2 levels, sometimes you can't tell which level. And when we do spinal epidural steroid injections, you can do it in a specific way where we target the injection, right?
Yes, you can. So as you just mentioned, there are overlapping symptoms with each nerve. And some patients may say, my leg hurts. Well, it's somewhat vague. But if you look at the images, you may have more than one nerve that is compromised. They don't all have to be symptomatic, but they may be equally symptomatic, so you can sort things out. Because if they're having difficulties maintaining their life function and activities, and they're strongly thinking about surgical options, if you operate on the long level, you may not get adequate relief, and the patient may be frustrated and has already exposed themselves to a surgical procedure, and they may have to go back again. So in many ways, we could be a best friend in surgical care for the patients also. It's got a very good predictive value. If you get no relief and the injection was done technically in a nice way, then you can rule out that level to be a contributing factor.
So for example, by the way, this is one of the biggest challenges as a spine surgeon, to figure out what to operate on, like what level, which side, how many levels. So if you do a targeted injection, the patient will get better temporarily for a while, right? If you're injecting the correct location.
It depends. Sometimes, we talk about diagnostic and therapeutic options. So diagnostic stuff, a lot of times we can just put anesthetic and you may get just a short-term relief. Most of spine care is not curable. Right? It's for most part management. There are patients who get injections, they get relief for only 5 hours. And we've done procedures on patients, they've lasted 20 years. Why? We don't know, but it has helped them. So we don't argue with the results. If it gives you adequate relief and this allows you to avoid more complex surgical cases, or your health is not going to support an extensive surgery, then you would want to consider non-surgical options. And if the medicine is not helping you, maybe invasive options. It's fairly quick to do these procedures in trained hands. It may be a couple of minutes to do this, and then you can have answers pretty shortly. So the results could be pretty quick also.
That's good to hear, because I can tell you patients are scared of epidural steroid injections. It's understandable, but it's pretty safe. So can you talk about what a patient can expect, what the likelihood of it being successful, being helpful for a reasonable period of time, and what might be the risks?
So let's talk about the risk. All procedures have risks. Getting worse, new pain, seizure, stroke, bleeding, infections, spinal cord injury, nerve damage, paralysis, death. Those are all standard with almost all invasive procedures. That's the same thing with surgical options. But they're very small. The reason we mention when we get informed consent is that they want you to know that these things have happened. Usually misadventure or some unusual anatomy that happened, or maybe not trained well, or maybe didn't follow the right protocol, but they're extremely rare. Right?
What's the most common complication that you encounter?
Most common complication or side effect? Complications are where...
Side effect. From a patient's perspective, they probably don't notice the difference.
Yeah, so in terms of side effect, because we use steroids, sometimes it makes them a little jittery or facial flushing. So sometimes they're like, oh, I couldn't sleep for a day. Those are the side effects because we're using steroids. Complications, they're extremely rare, less than 1% of the case. Most of them may be just local reaction to the medication. There's maybe some preservatives in there that may have caused some reaction to contrast, but they're extremely rare.
And how does it work? Why is it helpful for a patient that may have something like sciatica, a pinched nerve with pain in their back going down their leg, or pain in their neck going down their arm due to an irritation of a nerve root? Like, what's the rationale?
So there are a couple of things. Anesthetics and steroids work typically together. The anesthetic will give you short-term relief. It shuts off some of the signals that are firing off. And the steroids will give you longer relief because they bind to those structures in a stronger manner. So think of like a small opening where the nerve is coming through. Now you've irritated that, and now the nerve is swollen. So the goal is to bring that swelling down so there's less contact with the structures around it, which is why you have pain. So if you can bring the swelling down, that's where the best benefit is.
Because a lot of the pain is due to inflammation.
That is correct.
And then people ask me, how many injections can you get?
So
because we often will do more than one.
Yeah, there's no rule. You know, I have patients, and for the last 20 years, I've had patients who have come in every 3 to 4 months. Then I've had patients that I've seen once for one and never seen them for the same problem for 15, 20 years. So depending on, a lot of it is dictated by insurance companies. You should get at least 50% relief for about 3 months. If you don't, you can probably consider a different level or a different medication that can give you additional relief. If you don't get any relief, you have to reassess why you did not get the relief. Is it because the targeted site was not exactly the cause of your pain, or your physical exam didn't support, and the radiology that you looked at or the imaging that you looked at didn't go along with it? So you have to assess why they got no relief. If they get zero relief, it's clearly a missed opportunity to have done well for the patient. So
I would say that one of the key factors in the success of a surgical procedure is having the correct diagnosis. In other words, doing a great operation on the correct problem. And turns out the spine is not that easy to figure out. And the targeted injections, for me, a patient that has a positive diagnostic response and have surgery, their likelihood of success is sky high. Every once in a while, I have to do a surgery in a patient that had a negative diagnostic response for one reason or another. It's rare, but those patients only have like a 50-50 chance of getting better. So I really rely on that. And the non-operative spine specialists are critical to taking good care of our spine patients. So we really appreciate all that you do. Dr. Thomas, when would somebody have an injection before a lot of PT and other non-operative care? Because that happens sometimes.
Excellent question. If the patient has a significant injury and they cannot participate because the inflammation is so great that the oral medication is not making a difference, they cannot walk. Sometimes they may even have weakness. Again, with weakness, not everybody needs surgical options. The studies show that they will recover in most cases. So if they want to participate in PT, this is an excellent opportunity to get better with injections so you can participate in your care. You can contribute to your own management of symptoms. If you're traveling and you cannot see a surgeon and there's reasons not to consider surgical options, these are the places where you can consider injections to help you manage your quality of life.
I can tell you, like me, you're a big believer in customizing care for your patients. Every patient's unique. So some patients may need an epidural steroid injection early on for one reason or another. Most patients still need it kind of midway through their non-operative treatment course. Is that fair to say?
That is true. So it all depends on, we have patients who are older and cannot participate in physical therapy sometimes, and they're willing to do what it takes. Because sometimes helping them manage their quality of life, even just going to shop, they don't necessarily need to have a cure for the problem. They need something that allows them to be functional. This is where you can use this information. Tailor-making the care should be first and foremost in a physician's mind, because everybody presents the symptoms differently, and everybody's personal preferences are different. Their life story is different. Some may be a young parent with a small child got an injury, or it could be an athlete, or it could be an 80-year-old person with chronic degenerative changes, and they all have same expectation that they just want to avoid surgical options or just want to improve their quality of life.
That is really helpful. Can you try to summarize for the patients the key things you want them to take away from this discussion?
If you're thinking about spinal injections, you should be fairly comfortable and confident that it's a safe procedure that's available for most of you. If you want to participate in physical therapy and cannot do it, and you want to manage your own function, this is another option that you can do if the medications and physical therapy are not helping you. If you want to come down on your use of narcotics, that's another option for you. If you want to isolate the nerve root for the surgical options, that's another time where you can do an epidural injection to control your pain and symptoms. Basically, you can use this as one more tool to make your life better. And it's been around for more than 100 years, so the history of safety is well established. They all have some complications, like any procedure, any invasive procedure, they all have some complications, but they're extremely small and well-trained hands with best caution and precaution taken.
Absolutely. Spinal injections are a very important part of our care, so we appreciate you and all that you do. Thank you.
Thank you for having me.